Assalamu alaikum. We're delighted to have you all join us this evening. I know it's a very, very busy day for many of you in the sector. So really appreciate your being here. I'm going to start with a land acknowledgement. So the land that I'm talking to you from has been inhabited continuously for over 15,000 years. It is the traditional territory of the Anishinaabe and the Haudenosaunee peoples. It is also the land of the Petun and Huron-Wendat peoples and recognized officially as the land of the Mississaugas of the Credit River. It is also the land of the dish with one spoon wampum belt covenant between the Haudenosaunee and the Anishinaabe and other nations to share the resources and the caretaking of this land. Toronto, or Takaranto, is home to many Indigenous peoples from across Turtle Island. It is also the home of the red-tailed hawk, the eastern gray squirrel, the red fox, raccoons, white-tailed deer, bats, many insects and other species. And it is up to us to preserve them and let them live in peace with us. While it is important to do land acknowledgements, we must recognize that we must do more and ensure that we are not doing checkbox activism. Recognizing whose land we're on is a start, but we cannot stop there. At this time, the word reconciliation is on the mouths of many, including a lot of government officials, and often with a hollow ring, because there can be no reconciliation without conciliation, and there can be no conciliation without reparations. What that looks like is a conversation we need to have, and in consultation with the peoples of this land. We must remember that we are guests on this land, and we need to take care of the land that has been given to us as caretakers, merely to be here and enjoy its bounties and be grateful for being here. Today, as I mentioned earlier, it has been a busy day for many, many people. It is the National Day of Remembrance and Action on Violence Against Women. Let us pay tribute to the 14 women killed in the anti-feminist misogynistic massacre at the École Polytechnique in Montreal 33 years ago, and honor the lives of all those taken and affected by gender-based violence. I will now read out the names of the 14 women, and after which, let us have a moment of silence in their honor. The names are Geneviève Bergeron, Hélène Colgan, Nathalie Croteau, Barbara Degnaud, Anne-Marie Edward, Maude Haviernek, Barbara Kluchnik-Widajwik, Maryse Lagranière, Maryse Leclerc, Anne-Marie Lemay, Sonia Pelletier, Michel Richard, Anne-Marie Saint-Arnaud, and Annie Turcotte. Please let's observe a moment of silence in their memory. All right, thank you so very much. And I do want to remember all those missing and murdered Indigenous women. We know that there has been a recent murder of 4 more Indigenous women within this last week. And I know remembering all those whose lives have been taken from us is painful, but we must do that because that's why we're here today. We're here to do the work that's necessary to ensure that not another woman is killed in these brutal ways. So now I'm going to pass on the podium, the virtual podium, to Sabrine Azrak, our National Legal Services Coordinator, and she's going to be the facilitator for the rest of the evening. And she'll introduce you to the speakers and moderate the Q&A. Over to you, Sabrine. Thank you.
Thank you, Nazhat. Thank you all for joining us for the Canadian Council of Muslim Women's virtual launch of the GBV Review Guide as part of CCMW's new project titled Addressing Barriers for Muslim Women and Girls Facing Gender-Based Violence. This guide will assist organizations serving victims and survivors of gender-based violence in reviewing their policies, programs, and service delivery practices with the goal of addressing the barriers to and improving services for Muslim women and girls. CCMW's project Addressing Barriers for Muslim Women and Girls Facing GBV provides services coordination for Muslim women facing both gender-based violence and intimate partner violence. It also includes the development of a systemic change strategy and tools to address barriers Muslim women and girls face in dealing with GBV. This includes the GBV review guide being launched today that organizations and institutions can use to assess their policies, programs, and services that are relevant to Muslim women and girls. This project works in tandem with CCMW's Legal Services Coordination Program. It is the first ever program geared specifically to Muslim women in Canada. It provides culturally appropriate legal services coordination for Muslim women anywhere in Canada who are seeking legal counsel on family law issues. It serves as a one-step referral service designed expressly for Muslim women to address their unique needs resulting from complexities related to Canadian and Muslim family laws. CCMW continues to inform Muslim women of their choices and simultaneously educate organizations that work with Muslim women and girls to increase their organizational cultural competency. Throughout this launch, please use the chat box feature to ask questions. During the Q&A session, I will pose your questions to the speakers. And now I would like to introduce the speakers of today's launch. We are joined this evening by Silmi Abdullah. Silmi Abdullah is a lawyer and an award-nominated writer based in Toronto, Canada. She practiced immigration law for a number of years at the South Asian Legal Clinic of Ontario, focusing on the intersection of immigration, poverty, and gender-based violence. Most recently, Silmi started her consulting practice, working with organizations on various gender equality, anti-racism, and access to justice initiatives. Her debut collection of short stories titled Homes of the Floating Lily, or Home of the Floating Lily, was a finalist for the 2021 Danuta Gleed Literary Award and longlisted for the 2022 Toronto Book Awards. Our next speaker is Yasmeen Hussain. Yasmeen is a manager of public education and community programs at the Muslim Resource Center for Social Support and Integration. In her role, Yasmeen leads a team that develops and implements community education strategies addressing gender-based violence. She is passionate about community-based collaborative initiatives with Muslim women and girls that work towards creating safety and healing in our communities through greater awareness, accountability, and action. Our next speaker is Phoebe Quay. She is a legal services manager at Luke's Place, responsible for leading coordination of legal services programming in collaboration with the legal services director and team. With over 5 years of experience working at Luke's Place, Phoebe brings a wealth of knowledge, empathy, and insight into her role. She brings experience working with the family court system, most of which was in a role as a legal support worker, providing direct service support to women who have experienced intimate partner violence. Phoebe also leads the organization's work on the development and implementation of programs to expand reach and accessibility in communities that are underserved. Our last speaker is Sydney Marcoux, Director of Clinical Services at Victim Services of Durham Region. Sydney is a registered social worker with a multitude of experience, community-based crisis and case management services, clinical and therapeutic counseling, emergency department, the ICU, and medicine programs. She has worked with victims of gender-based violence in all of these areas and has worked with HT clients in the ER. She has a strong trauma-informed knowledge base as well as education and family mediation and law. It is now my pleasure to pass it along to Silmi Abdullah.
Thank you, Sabrine, and hi, everybody. Good evening, and thank you all so much for joining. today. As Sabrine mentioned, my name is Silmi Abdullah, and I'm the consultant on CCMW's Gender-Based Violence Project and have worked on developing this guide. I'm just going to, before I start, I'm just going to share my screen to show you what the guide looks like. Can you all see my screen? Okay,
Yes.
great, wonderful. So I'm really excited to introduce this guide to you and discuss some key aspects of it. But before I go any further, I would really like to acknowledge the valuable feedback and the expertise of the many individuals and partners that have supported us in this project, and without whose support this guide would not have been possible. So first of all, I'd like to thank our advisory committee members, Alia Salim, Amy Kaufman, Nania Bukhari, Liz Makhben, Lubna Zaim, Natasha Akhtar, Nazila Iskandarova, Nazish Tayeb, Phoebe Quay, Ikra Rafiq, Yasmin Hussain, Yusra Qadir, and Priya Shastri. I'd also like to extend my sincere thanks to the 7 partner organizations who have tested the guide on their respective organizations. And 3 of them are actually going to be speaking tonight. And so these organizations are South Asian Legal Clinic of Ontario, Victim Services of Durham Region, Luke's Place, Muslim Resource Center for Social Support and Integration, Sakina Homes, Barbara Schleifer Commemorative Clinic, Islamic Family and Social Services Association. And of course, I'd like to thank my team members, Zainab, Sabrine, Hannah, Iman, and our Executive Director, Nuzhat, and finally our funders, our funder, Women and Gender Equality Canada. So what is this guide all about? So the guide is called Policy Program and Practices Review Guide, Strengthening Supports and Services for Muslim Women and Girls Facing Gender-Based Violence. So Sabrine has provided an introduction, a brief introduction to the guide. So really what this guide is meant to do is to act as an aid and a resource for organizations and institutions to critically examine their policies, programs, and service delivery practices, which are relevant to Muslim women and girls and gender diverse people facing gender-based violence, and with a view to addressing the barriers that Muslim women and girls face, as well as to improve the policies, programs, and practices in order to ensure that the services that organizations are providing are effective and appropriate. And so why the need for this guide, and why the need for it now? So and why focus on Muslim women and girls and gender diverse individuals? Well, first of all, we know that Canada is home to a large Muslim population. And in 2021, Statistics Canada said that Islam was the 2nd most commonly reported religion after Christianity. And over the last 20 years, the Muslim population, the percentage of Muslim population has more than doubled. So now more than ever, it's critical to address the growing needs of this community. And also importantly, we know that gender-based violence is a global phenomenon. It happens in Canada, it happens all over the world, it happens in every community. So I really want to emphasize the point that gender-based violence is not something that is exclusive to the Muslim community. And in no way do we suggest that it's something that is more pronounced in the Muslim community. However, why we need to focus on the Muslim community is because of the unique the systemic factors, the various systemic factors that give rise to unique needs for Muslim women, girls, and gender diverse individuals, as well as the unique barriers that they face when accessing supports and services. And we know that there are different systemic factors that give rise to different complexities of the experience of gender-based violence, as well as barriers for various marginalized communities. So for example, racialized communities, faith-based communities, newcomer communities. So these can include language barriers, immigration status, poverty, and we know that these factors have increased during the pandemic as well. So, and then of course there's systemic racism and discrimination. For the Muslim community in particular, we know that Muslim women and girls face, not only may face violence within the home, but as they try to access supports and services, there may be, and there is, in fact, racial discrimination and prejudices because of the climate that we live in, because of Islamophobia, because of prejudices and, discriminatory attitudes towards the Muslim community. So often the way it manifests is that we end up seeing laws and policies that penalize the community as a whole, which really does not go into the root causes and the complexities of gender-based violence and why it's happening and what really are the needs of this community. And so essentially what it does is it leaves women and girls and gender diverse individuals with a choice between staying in the abusive situation or a situation of violence and giving up their religious values. So these are the nuances and complexities that this guide tries to address, and it's really a way of thinking, critically thinking about these issues and looking at how we can improve our policies, programs, and practices to best address the needs of women, girls, and gender diverse individuals facing gender-based violence in this community. So, so I want to sort of walk you through some of the key aspects of this guide, just to sort of give you a brief orientation in terms of what the guide entails and how we have designed it. So this is essentially the table of contents. So we have some introductory sections about CCMW, the acknowledgements, a brief introduction to CCMW's gender-based violence project. Again, why the need for this guide? And this section actually gives you a brief orientation to the guide. So essentially what I'm telling you now is what you'll find in this section too. So what are the different sections of the guide and how do you use it? So the first thing we have included here is preliminary considerations. So when, as an organization, when you're thinking about reviewing your policies and practices, I guess the first question to ask is, which aspects of my organization am I reviewing? So the three aspects that we suggest are policies, so written policies, programs, as well as service delivery practices. So an organization may have excellent policies, excellent program design, but that doesn't mean that it necessarily translates into what's actually happening on the ground. So we have proposed I guess the idea of looking at all three. So what are the policies? What policies do we have? What do those policies say? How are our programs designed? How are they implemented? And how are our staff members, management, volunteers, how are they interacting with our service users? And then what is the purpose of the review? So why are we even reviewing our policies, programs, and service delivery practices? Of course, the goal is to improve services for Muslim women, girls, and gender diverse individuals. And then what is the overarching inquiry? So what is the question that we're asking? And what are we trying to find out through this review? So the overarching question is, are the policies, programs, and practices effective and appropriate? So that's really the guiding question throughout the review. And then we have created a framework in order to check how our programs, policies, and practices can be effective and appropriate. So what are the criteria that we need to comply with in order to ensure that our policies, programs, and services are effective and appropriate? And so the overarching analytical tool that we're using, or we have used both in designing this guide and also as the framework for checking compliance for effectiveness and appropriateness, is gender-based analysis plus. This is an analytical tool that was developed by the Government of Canada, and essentially what it does, it allows or enables organizations to critically look at their policies and programs to see how they're impacting people based on their gender. So gender may be an entry point, but at the same time, the plus is actually for considering other intersectional identity factors. So for example, national ethnic background, disability, age, all those things. So how do these factors all come together to create someone's experience of engaging with policies and programs? So a policy or program may look neutral on its face, but it may have disproportionately negative impacts for someone based on gender and other intersecting factors. So what are the questions we can ask to figure out whether the policy and program is really inclusive of diverse groups? So that's really the overarching analytical tool that we've used, or we suggest using throughout the review. And then within this overarching analytical tool, we've come up with, or we have included four guiding frameworks, which will inform whether the policies, programs, and services are effective and appropriate. So the four guiding frameworks we've included are human rights law, trauma and violence informed approach, anti-racism and anti-oppression, and cultural safety. And for each of these frameworks, we have come up with review questions, and they're divided into the three aspects of review. So we have a set of questions for assessing your policies. And then we've also included a case study as an example to see what are some of the problems with that example, and what are some of the best practices in accordance with that particular guiding framework. And then we've done it for programs, and then we've also done it for service delivery practices. And if you go down, you'll see that we have the same background breakdown for each guiding framework. So we have questions for assessing policies and seeing whether they comply with the trauma and violence informed approach. Programs, service delivery practices, same thing for anti-racism, anti-oppression, and cultural safety. So the reason why we've chosen these four frameworks is because we felt that these frameworks together really create a comprehensive way of understanding the different barriers that Muslim women and girls face when accessing services, and really critically looking at how we can improve our services. So human rights law, or principles of human rights, because essentially we know that gender-based violence is a manifestation of gender inequality, and it's a violation of human rights. That's what our international legal instruments say. That's what our domestic laws say as well. So really, gender inequality falls within the umbrella of human rights legislation. So I think the first point, or the first I guess step in assessing whether policies, programs, and services are effective and appropriate is to see whether they comply with our provincial or federal human rights laws. So service providers are generally legally obligated to comply with human rights laws, and depending on whether you're provincially regulated or federal, different laws will apply to you. And I do want to mention here that this guide, or the information in this guide, is not meant to provide legal advice. It's only meant to provide some legal information and a basic framework. And of course, in order to really check whether your organization is fully complying with human rights laws, you would have to seek advice from a lawyer. And so in this section, we have given background on some of the international legal instruments and domestic laws that may apply to your organization. So that would include, for example, in Ontario, it would be the Ontario Human Rights Code, which prohibits discrimination on grounds such as sex, gender, gender identity, gender expression, all those things. And so some of the questions you might ask when you're assessing policies is that, does my organization have a policy on anti-discrimination and anti-harassment, right? And then what do those policies say? Is there a complaint mechanism built into that policy? Are service users or clients aware of those policies? Do they know what their rights are? Do they know where to go if they have faced discrimination? So all those things. And then trauma and violence informed approach. So this approach looks at the connection between violence, trauma, negative health outcomes, and behaviors. And trauma is really the lasting emotional response that often results from living through a distressing event, and that could really harm a person's sense of self, sense of safety, and their ability to regulate emotions. So a trauma and violence informed approach understands what trauma is, understands the connection between trauma and violence, and really tries to, within an organizational space, tries to create an emotionally and physically safe environment for the person coming in to seek services. And so we have included some key principles of a trauma and violence informed approach in this section. And then we go into anti-racism and anti-oppression. And I do also want to mention that anti-racism, anti-oppression, trauma and violence-informed approach, they're not necessarily, we don't necessarily need to look at them in silos because a lot of the principles will overlap. And that's why we think that all these four frameworks together work really well. And so anti-racism and anti-oppression really looks at systems and structures and how systems of power or systems of oppression create, individual instances of discrimination and oppression. So, for example, colonialism, racism, homophobia, transphobia, all those things. And how are those systems of oppression built into our organizations? Do we acknowledge that they exist, and how do we dismantle those in order to create, in order to minimize the power imbalance and really allow people to express and share their experiences in a space that is non-judgmental and in a space that is non-hierarchical, right? So it goes beyond diversity and inclusion. It's really about looking at how our systems and structures and how our own positions of power and privilege are creating unequal outcomes for service users. We also include principles of integrated feminist anti-racism, anti-oppression, which is also known as IF-ARAO. And this goes a step further in looking at how systems and structures of power and privilege impact particularly survivors and victims of gender-based violence. And it gives victims and survivors the agency to make their own decisions and to share their experiences in a space of non-judgment. And it really, it allows for more collaboration, and it also ensures that victims and survivors are not blamed for their experience of violence. So they're treated within this approach, they're treated as experts of their own experience. And then finally, the framework we have is cultural safety. Now, we often hear about the term cultural competence when we're thinking about service delivery, and cultural competence is a more commonly used or known concept, which is about understanding the differences between cultures and gaining knowledge about different cultures. But cultural safety goes a few steps further. So what cultural safety entails is recognizing culture as a strength and really questioning how one's own beliefs and value systems are impacting how we provide services to somebody. What is the language that we're using? Are we inadvertently perpetuating stereotypes against another culture? Do we understand the fact that cultures are not homogenous, and even within the same ethnicity or the same faith, there may be different cultural practices. Is it a two-way learning, right? So often what happens in the cultural competence framework is that we still have a dominant culture, and other cultures are sort of like plugged in or are supposed to fit into that dominant cultural framework. Whereas cultural safety is a way of questioning that, and is a complete way of working with diverse groups so that we create we try to minimize, again, that inequality of that dominant culture versus marginalized cultures, and providing a space for everyone to safely address their needs and let them decide what they consider as culturally safe, and continuously educating oneself and acknowledging the fact that we may not know everything about a culture, and really to gain that knowledge from those that are coming to us to seek services or assistance. So really, those are the four frameworks that you will see throughout this guide. And again, we have review questions that we have developed under each framework. And then the next section is how we actually conduct the review. So this is all the practical aspects of the review. So we know the frameworks, we've understood the frameworks, we know the questions to ask, but where do we get the information, right? So here we discuss the information source for your review, and we've suggested 3 different information sources. So one could be reviewing documents, right? So reviewing written policies or any other documents that you may have in your organization. Interviewing your organizational leaders. So the knowledge, looking to the knowledge and expertise of your ED, your CEO, or someone from management, right? And then finally, which I think is one of the most important aspects of the data collection or getting the information that you need, which is the interviews or focus groups with your service users. So really centering the voices of those that we're doing this for, right? So conducting focus groups and surveys with victims and survivors of gender-based violence, and really asking them what it is, what they feel are the strengths of the organization, where did they feel the gaps were, and what changes would they like to see. So those are the 3 different information sources that we propose that organizations use when conducting the review. And of course, different questions will be answered through different information sources. So for example, a lot of your policy and program related questions will be answered through reviewing your documents. And if you don't get your answers from the documents, you can go to your organizational leader to get those answers. But I think a lot of the service delivery practice questions will be answered directly through the service users, right? So then you're going to have to sort of do an assessment of which questions will be answered through which avenue. And then we go into the data collection method. Again, we include some GBA plus considerations in the data collection method. So for example, when you're doing a focus group or when you're sending out a survey, are you accommodating diverse groups, right? So a GBA plus analysis would consider those things. So for example, if you've designed a survey, but you're asking for people, or if you've designed a focus group questionnaire and you've asked people to come in person on a weekend, that might exclude, for example, single mothers who may not have childcare on the weekend. So you're excluding a significant chunk of your participants by not accommodating that group, or by not having the focus groups in different times or days of the week. Or if you're only making it available online, that may exclude more senior participants who may not be that technologically savvy. Or if you're only doing it in person, that may exclude a lot of young people who are more comfortable with using technology. So those are examples of GBA plus considerations in making sure that you get the most number of people to share their experiences, right? And diverse groups of people. And then we have some practical tips on how you organize your data, how you can plan your documentary review, planning your interview with your organizational leader. And then this goes into detail about planning your focus groups or individual interviews with service users and clients. So we go into recruiting participants. How do you recruit participants? We suggest using a preliminary questionnaire. So really the preliminary questionnaire is to get clients or get potential participants to share what their preferences are. So would they prefer doing the survey online, or would they want to do it in person? What times of the day they're available? If they're coming in person, do they have any dietary restrictions? Do they need childcare arrangements? So all those things would be determined through the preliminary questionnaire. And then we have a written survey. And this survey asks more, demographic, more basic background questions. So age, income level, ethnic background, any sectarian affiliation, those kinds of things, because when you're actually doing your data analysis, that background information can help you determine certain trends, right? And then finally, we have the focus group interview, and this is where participants will actually share their experience, not only their experience of violence, but what specifically their experience was when they came to your organization to ask for help, right? So this is their opportunity to share what they think are the strengths and the gaps, and what changes they would like to see. And then we have some sections on ground rules for facilitators, reminders, how to manage difficult situations, those kinds of things. And the next section talks about how you record the results of the review. So we have a sample report outline. So once you have all your information, analyzing the data and then putting it all together in a report. And the next section has glossary of terms, what other guides and projects we consulted. And I think this section is quite important, which is the appendices. And here we have included some templates for organizations to use as they're conducting the review. And we found that this was really helpful when we were doing the test with our 7 partners. So what we've created, I'm going to go first to Appendix B, which is the documentary review template. So here we have included, when you're reviewing your documents, we've included the policy and program related questions that you can ask as you're reviewing your documents. So you can list here what policies you reviewed, which documents you relied on, what are the applicable laws for your organization. And you can answer these questions for policies and programs for each guiding framework. So we have this template for the documentary review. And then next we have a sample interview template for organizational leaders. So here we've asked some background and contextual questions for your organizational leader. So for example, what are the trends they're seeing? What percentage of their clients identify as Muslim? What changes they see in trends during the pandemic? And then we go into the specific targeted review questions, again, under each framework. So human rights law, trauma and violence, informed approach, anti-racism, anti-oppression, and cultural safety. So you'll see that a lot of these questions are the same as the questions that we asked for the documentary review, because there's a lot of overlap. So if the idea is that if some questions are not answered through your documentary review, you can then look to your organizational leader to answer those questions. Then we have a template for the preliminary questionnaire for service users. So, it asks a question like, are you a current client, former client, what language you're comfortable with? Do you have safe access to a computer, phone? So essentially this is to gauge how best to engage them in the subsequent survey and the focus group. And next we have the sample survey questions. So we've developed a whole set of questions. And then finally, we have the focus group questionnaire. So, and I do want to show you one last thing, actually. Sorry, give me one moment, please. So Appendix A, master template for organizing your data. So we found when we were doing the test with our 7 partners, we found that a template like this was really useful to sort of amalgamate all of your data into one document. So we've essentially, you don't have to do it like that, but we found it was useful for the partner organizations that did the test, and it's really there to assist you with your data collection. So the way we've organized it is that under each framework, we have the questions for policy review, and then we have our information source. We have a column for each information source. So from documentary review, from organizational leader interview, and from service user interviews and focus groups. Essentially, the different templates that you saw earlier, you would take the answers from each of those and then put it in this master document. So, and then we have it for program review, and then we have it for service delivery practices review. And then we've done it for each guiding framework. So that's really all I wanted to say about the guide. I know it was a lot, so if there's any questions, I would be happy to answer at the end. I do believe we have a video recording now from one of our partners who will speak a little bit about her experience using the guide during the test phase. So thank you so much for listening.
Victim Services of Durham Region. Hi, everyone. My name is Sydney, and I'm the Clinical Director here at Victim Services of Durham Region, proud community partner, of the Canadian Council of Muslim Women. I want to thank Tommy for inviting me here today to share our experience with the guide that she's developed to help us to understand systemic barriers of women and girls, Muslim women and girls who are facing gender-based violence. For those who don't know a ton about victim services, I'll quickly give you a little bit of insight into the work that we're doing in the community. So victim services supports any person or family member who've experienced victimization by crime or tragic circumstance. We work very closely with many community agencies to ensure that we're meeting the needs of the community and specifically with Durham Regional Police as they help to bring attention to referrals to us for those who have been impacted by tragic crime or circumstance. It is important to note that, of course, we are not, directly affiliated with Durham Regional Police, and we do operate as a separate entity and a separate organization altogether, where we're able to offer client confidentiality and do not expect any of our service users to be reporting or be involved with DRPS at all. So just for some reference, what I thought was so great about this project and why I felt it aligned so well with the work that we do is that last year alone, our referrals for intimate partner violence were over 4,500. And additionally, for our human trafficking program, we saw an increase of 350 new referrals. And I mention that because we understand that the majority of those who are impacted by intimate partner violence and human trafficking and gender-based violence are women and girls. So this project really did align very well with the work that we're doing. We were able to review our policies, our programs, and our services throughout this guide from the lens of anti-oppressive practices, anti-racism practices, trauma-informed, and of course, cultural safety. This project took quite some time and quite a lot of, review, but of course with all really great outcomes. So again, we found it to be extremely helpful, and I'm going to go into now some themes that we were able to pull out. First being that we were pretty proud of the policies and our programming and procedures as it related to anti-oppressive and anti-racism work, and able to go through that review process quite smoothly, of course, with acknowledging there's always room for improvement and keeping ourselves educated on how to be the most trauma-informed, anti-oppressive and anti-racism organization that we can be. Specifically to the trauma-informed piece of the review guide, us at Victim Services, we're really proud that we're a trauma-informed agency and a survivor-led agency. We have a panel of human trafficking survivors who allow us their time and their insight and their experience into shaping the programming that we're doing. And what we were able to pull from the guide is how we can implement that approach of survivor-led from not only the human trafficking lens, but how we can perhaps look to our community for those who have experienced gender-based violence and how they can too help to implement the programming that we're doing. Another sort of theme that was pulled out from this is this surrounding cultural safety. And, unfortunately here at Victim Services, we weren't aware of a cultural safety policy. We didn't have one for ourselves. And that's something that, of course, has been a major takeaway as we work to develop that now. I appreciated the best practices and the examples that Silmi and her team were able to implement within the guide to allow us to better work towards developing the cultural safety policy. So I do very much appreciate that. And additionally, another major theme that we were able to pull out and how it aligns with our strategic plan here at Victim Services is, working to diversify our agency. And that has to start from our board of directors, our management, and our hiring processes. So we've definitely acknowledged that by using the guide as well, but that's something that we will be working to improve here at the agency. overall, our experience working with Silmi and Canadian Council of Muslim Women through this guide has been incredibly impactful. And we appreciate being selected to participate in this trial phase. I can share that, we have taken the guide since, originally completing it, and we've actually are looking to apply it to a program that we access here at Victim Services called the Victim Quick Response Program, or VQRP for short. This is offered to those specifically people who've been impacted by crime or tragic circumstance. And it is a program that helps to support safety planning and access to many different things after somebody's experienced such a traumatic event, things like crime scene cleanup, things like access to shelter supports or housing, basic necessities, and things like clothing and food for anybody who qualifies for the program. And what I can say is that we're taking this guide and all of the pillars that it had, and we're applying it to that program specifically. And we hope to bring that to the attention of the ministry, and how we're able to bring things to their attention about how the programming could be discriminatory towards certain groups, and not allow for equal or equitable access to this programming. And our goal is really to ensure that anybody that is entitled to this program has access to it. So again, a huge takeaway from this project is being able to not only, do this once for the purpose of completing the project, but able to continuously apply it as we continue to develop all new policies, all new procedures and programming and services that our clients will then have access to. So again, thank you so much for having me here today, and good luck with the work that you're doing.
Great. So now I'd like to invite another one of our partners, Yasmin Hussain, to say a few words about her experience.
Thank you so much, Silmi. Assalamu alaikum, everyone. Thank you so much for having me here. And before I start, I want to start off by just congratulating CCMW on this wonderful guide and being able to launch it today. I think it's clear from what Silmi shared, so much work and research has gone into developing this guide, and we were really happy and proud, as always, to partner with to participate with CCMW in this project. And as a community partner. I think it's always important. We share a similar goal of supporting safety of Muslim women and girls in this country and in our communities. And so to have a tool or guide that allows us as an organization to think practically about our policies, our programs, and how we provide services and how that is implemented is really incredibly valuable. So as Silmi mentioned before, I work in London, Ontario at an organization, a small nonprofit called the Muslim Resource Center for Social Support and Integration. We work within the Muslim community and engage a culturally integrative model to address gender-based violence and promote family safety. And in some ways, you might think that working within the Muslim community, you can get complacent about how we do our work and thinking that, we have the tools to create safety within our communities, which we do. But I think with this guide, what I appreciated about participating in this project and this guide is that it created an opportunity for really important critical reflection on what our policies and programs and practices look like, and are we meeting the needs of the diversity of the Muslim community in ways that are unique to those specific needs, to marginalized communities within the Muslim community, including based on sect, racial background, sexual orientation, all those pieces. So it allowed us to really explore important critical questions and think about our service and policies and our programs and service practice in using multiple lenses and really thinking about safety much more complexly and more comprehensively, which I think is really important. And so I felt as this tool, the guide, as Silmi shared, really organizes a process so beautifully for us to go through and think about how we're doing and assessing. And I think it raises and it created a space, and I'm hoping, as was mentioned before, is thinking that it's not a one-time process. It's a process that you can do continuously and always go back to, and also do in a collaborative way within the organization. And so that's what I appreciated, that it creates an opportunity to use these questions and to use this guide to have important conversations within our organization as a team, and to assess maybe, different people working in different areas have different understandings or different experiences, and have different ideas to contribute to how we can improve our practice. I think that is important. And I think another theme that came up is thinking about those survivors and individuals who are accessing our service. How are they, what is their voice and what is their input in terms of the programs we have, their experience of our programs, of the services we provide. Yes, we do evaluation of programming, but this is a very different kind. It provides almost another lens to thinking about what we're asking of program participants and service users at our organization regarding their experience of cultural safety or trauma. Is our programming trauma informed? And so I think this tool is so important for our organizations, for all our organizations, to really think critically about how we're serving and supporting and meeting the needs of Muslim women and girls, and gender diverse individuals in our communities in particular. And I think that's probably the key piece for me within the Muslim, working from within a Muslim community perspective, is sort of broadening how we're thinking of who we're providing service for and how we're providing our service.
Great. Thank you so much, Yasmin. And finally, I'd like to invite our partner, Phoebe Quay from Luke's Place, to say a few words.
Thank you, Sylvie. And thank you for inviting me to be a part of this panel and your launch. Congratulations. And I guess I wanted to start briefly by talking about an aspect of the work we're doing at Luke's Place that has really very much fit so well with this project by CCMW. This project has been really extremely important and has been invaluable to how we are thinking through our work with women. Luke's Place, as an organization, we focus on improving the safety and experience of women and their children as they proceed through the family court system after leaving an abusive partner. So the work that I'm leading at Luke's Place is at evaluating the communities of women who access our services, particularly focus on how to enhance our service delivery to meet the needs of underserved women. So we have been supporting women from time who have intersecting identities, and with the work that I'm leading, we wanted to focus our attention on understanding what those intersecting identities are, how it affects the way in which women navigate through the family court system, and our services, and how do we enhance our service delivery in order to meet those needs. So when we were approached with being invited to be a part of this project, I was really, how we had first started off is that we wanted to review the process, and having this guide was really comprehensive, and it really helped us be able to think through the preliminary questions for the evaluation of our organizational policies. So questions in a guide that ask us to think about whether our policies take into account, for example, the differences of experiences and needs of Muslim women. Doing a deep dive, we really understood that a few of our policies we realized have an intersectional feminist framework, and they illustrated that, but it was interesting to see where we're at and how we could grow by using this guide for sure. So for instance, we know through our service delivery that we have been supporting Muslim women when it came down to recruiting women for the focus group part of this guide. We had hit a roadblock. Unless a woman self-identifies as Muslim, we really didn't know how to really track that. And of course, we can't assume. So this project really helped us to be able to pay attention to how we're doing this work and how we're evaluating the communities of women who access our services. So now we've been able to now pay attention to our intake process, for example, asking questions that will help us to be able to support us in sort of identifying the communities of women that we serve. And as Sydney and Yasmin mentioned, that cultural safety piece was something that was very eye-opening for us, because we were in the process of revamping our policies when this came about. So that's something that we're now adding to this revamp of our policies for sure. And so it's so integral for us to be able to include that as an addition for our agency. The case studies and questions for assessing our groups were helpful, as we are currently working on integrating it into our case management process. So our frontline workers we usually have a case management meeting. So we're now bringing up trends, barriers, needs, gaps that we're noticing or observing when it comes to how we support Muslim women and girls. And we've used in this guide to be able to now integrate it into our case management meetings and our process. And I think it's really going to it's going to really pave a long way for us as we move forward in changing some of this dynamics within our organization. As a whole, this project has really steered us into a bigger conversation within our organization that we had not initially anticipated. We didn't want this project to be a checklist or to be a project on its own. We really wanted to be intentional in how we were thinking about every aspect of our programming and our principles. And we wanted to be able to, in turn, use whatever we've gathered from the evidence from this guide and really turn that into like more evidence-based changes within our organization. So we're very grateful to be able to have this guide to be able to use for that purpose for sure.
Well, thank you so much, Phoebe. Thank you for sharing your thoughts and your experience working with the guide. I think I'm going to turn it over to you now, Sabrine.
Hello, can everybody hear me okay?
Yep.
Okay, so we are now going to the question and answer session. Again, if anyone has any questions, feel free to share it in the chat box. If it's okay with the speakers, we could also allow for attendees to unmute and ask their questions. Our first question is from Carlos. Carlos asked, you mentioned that your organization also works with minorities within the Muslim communities, such as sectarian or sexual minorities. My doubt is how exactly you manage to work with these minorities. Exactly. Who would like to begin with this question?
I think this was directed to Yasmin. He said, I have a question for Yasmin Hussein. So, Yasmin.
And I think, Carlos, I want to focus on how this guide allowed us to assess.
I am having a hard time hearing, so I don't know what's happening on my end. I'm going to mute myself and fix that. Just give me a moment.
Should I continue?
Go ahead.
I think I brought that up in relation to the guide, Carlos, because I think the guide in term that CCMW developed in terms of integrating all these guiding practices, and for us as an organization working within the Muslim community, it's also assessing the barriers that we might encounter or that Muslim women, girls, or gender nonconforming individuals might encounter in terms of accessing our service. And so I think that to me is such a critical question in terms of thinking about how do we as an organization recognize that there are also barriers that we create that may exist for members within the community we serve, accessing the services we provide at the Muslim Resource Center for Social Support and Integration. And I think that's an important or critical question, because it's easy to assume when you work within a cultural context and within a cultural community that because that people, it's easily accessible, and that barriers might exist more commonly with mainstream organizations, which is not always the case. And so I think it raised for us, or created an opportunity for us to really think about using these guides and using the questions that are so comprehensively mapped out and that are really thoughtful and really allow for us to be more thoughtful in terms of thinking about who is accessing our service. And I remember having a conversation with Silmi thinking about who isn't maybe accessing our service. And we do have people from the diversity of the Muslim community and individuals who are marginalized accessing service. Sometimes they do access service, but thinking about, has the service been safe? Was it easy to access? Would they recommend it to others? Were there issues? And I think those are critical questions we need to be asking in terms of thinking about the barriers that people may experience, and recognizing that individuals will experience various barriers. And I think that's important for us from our end. So that's how, sorry, I probably didn't explain it well, why it was for us important to draw attention to that.
Thank you, Yasmin, for that answer. Did anyone else want to chime in response to Carlos's question? Okay. Okay, do we have any other questions from the attendees? Feel free to unmute.
Maya has her hand up.
Okay, go ahead.
Yes, Assalamu alaikum, everybody. I just have a quick question, and I'm not sure if you have already covered this throughout the presentation. Is your guide being shared with various social service agencies and community agencies and such as well? Is this guide specifically for Muslim resource centers, and is it being distributed to like CAS and community centers and other agencies that are providing support for women who are in domestic relationships and such?
Hi, Maya, I can
Domestic
answer that
abuse.
question.
Yes,
Yeah.
please. Thank you.
Hi. Thank you. That's a really important question. So yes, the guide is publicly available. It is on CCMW's website. So, and that's actually one of the things that I wanted to mention during my presentation as well. So it's definitely not meant to be specifically for organizations that are mandated to serve Muslim communities only. It's meant to be used, or it's meant to be of value to organizations and institutions across sectors, right? So anybody, any institution or organization that serves diverse groups or you know, provide services to clients who may be facing gender-based violence can use this guide. So it is available for sure to everybody.
So I know that it's available on the website, but so I used to live in London, Ontario, and I used to work at a community health center, and we were working with a lot of we were working with a large Muslim population who was facing domestic abuse and young girls and women issues pertaining violence and abuse. And they were not aware of the resources in London, Ontario. Now, Toronto and other areas could be very different. But I know that from my experience working at a health center myself, a lot of the staff were not aware of the resources in London, Ontario pertaining Muslim communities. So is there any way of maybe connecting with managers or directors and such, and physically like sending a copy or a link or something that healthcare providers and community agencies can actually refer to? Is that something that you guys are looking into? Because if there's not a Muslim woman or a Muslim person that works in an agency, they are not going to connect the Muslim family or a woman or a young girl to a service that is direly needed to them.
Yeah.
You know, because I'm speaking of my own experience, you know.
No, absolutely, and I completely agree. And we are definitely looking into distributing it to as many organizations and institutions as possible. So for sure.
Yes, and it's great work. Like, it's an amazing tool to have.
Thank you.
And I remember that when the time the Syrian refugees had come into London, Ontario, there was a huge surge of them, and we were heavily involved with other community partners, trying to settle them in and into Canada, and the trauma and the violence that had gone on in that was going on in their families. And our agency became very heavily involved with Muslim Resource Center and CAS, and the police, trying to settle other settlement agencies, trying to support the staff, understand the culture from a cultural perspective, right? So I can understand that this is really great work. It has come a really long way, and I'm very excited to see where it's going to go next, and I'm hoping that it's going to be readily available, and people can say, okay, you know what, this is what they have, and like you guys, this is what you have provided, and the research shows that this is the kind of help that we can seek and support our Muslim families, because it's needed.
Yeah.
Canada has a very large Muslim population, and thank you so much for creating this work and this platform for us to learn from, and also pass on to our agencies.
Thank you. Thank you so much.
Thank you, Maya, for that. And Silmi, for your response. I am looking around for hands up. I don't see any. I see a question by Amber, and I'll read that aloud. Amber asks, I work at a women's shelter in London, Ontario, and I'm curious if you are connected with Sakina, and if survivors express concerns with using a translator from their community due to a fear of a breach of confidentiality. I can answer very briefly and say that we do work with Sakina, and we haven't had any concerns thus far with clients being weary of using the translation services for that specific reason. Anybody else would like to answer Amber's question?
I can briefly address it. It's
Of course.
So one of the things that we have experienced is when someone contacts us, a Muslim woman contacts us, sometimes she doesn't want us to actually refer her to another Muslim person, particularly from the same community. So they would rather be speaking to someone who is not Muslim or who's not familiar with the local community that they're calling from. And then sometimes the opposite is true when they insist that they want to talk to a Muslim social worker or a counselor or a lawyer. So it really depends on what they say. Again, going back to the approach that Silmi talked about, going back to that particular client and asking what they need, and then trying to find them the right solution, either find, the person that they're looking for who can help them. But really, that's what happens. Sabrine, you can jump in because you talk to all the women all the time. Sometimes I'm the first line of contact, but then, they do speak to you. Silmi's got her hand up too.
Go ahead, Silmi.
Yeah, thank you. That's a really great question, because that's something that, as Nuzhat mentioned, that's something that we do see sometimes. And I'm speaking from my experience as a former immigration lawyer, where sometimes I had clients who identified with a specific ethnic background, and then the client would say, well, I don't want a lawyer from that background because I'm worried that the word's going to get around, or I'm worried about confidentiality. So that's something that we actually mention in the guide, and that's all part of the cultural safety piece and doing the anti-racism, anti-oppression work, where you really treat the clients as agents of their own experience, and you give them the agency to decide for themselves. So it all goes to that notion of not making assumptions that just because somebody identifies as Muslim, they're going to want a Muslim therapist or a Muslim counselor or a Muslim lawyer, right? And so it's really about asking the client what it is that you need. Sometimes, like Nuzhat mentioned, sometimes they may want specifically to speak to somebody from their background, and sometimes they may not, for different reasons. So it's all about really understanding what the individual needs of that client is. So, yeah.
Thank you both to Somi and Nazhat for your responses. I see Saraya, you have your hand up. Please go ahead with your question, Saraya.
I'm just going to comment as a user of the service, because I recently had a client who didn't live in Toronto but lived in Montreal. And you know, sitting over here, I have no clue who are the lawyers here. We try to be selective in the lawyers that we suggest, because then we've had some experience with them. I had no idea, and Sabrine was just amazing in that she, you know, she put them in touch with the right people, and that allowed me to pull back, because I knew that they were in, she was in good hands, and also, I think either it was Shaheen or Farhad that put me in touch with Nisa Homes in Montreal. And so I'm really, really grateful for the support that was provided. So thank you. I think it's an amazing, amazing resource that we have. Thank you, Sabrine.
Thank you, Saraya. It was a pleasure working with you. One thing that we do find difficult is building honest and strong partnerships with lawyers and other service providers based on trust. Sometimes we'll refer a client to a lawyer or a service provider and they are not happy with that provider or lawyer. And that is something that, you know, we can ask if a lawyer has taken some sort of domestic violence training and so forth. But really, if the client had a bad experience and we look into that, sometimes we remove them from the roster. We make note of that. There is a lot of trust. And so sometimes people are not always pleased with the lawyers that we connect them with. And we wish that we can have deeper connections with each of the lawyers, but you can imagine just how extensive this roster is because it's on a national scale. So we deeply appreciate your feedback, Saraya, and we make iterations to the roster and the services so that it only improves. So thank you for that feedback. And I see another question by Amber. I believe it's a question. I'm just going to read it out loud. I also work with women's shelters in Manitoba, and I'm wondering if in the guide there's information on supporting Muslim women and girls specifically living in rural areas due to having different needs, stigma, and less available resources. Supporting those living in urban settings can look a lot different. It definitely can look very different, Amber. You're right. I can pass that along to Silmi.
Yeah, thank you, Amber, for that question. It's a very important question. So we actually don't have specific information on providing support to Muslim women and girls living in rural areas. So I do want to mention that this guide is not set in stone. It is a living document. So we're always open to feedback. So we will definitely take this feedback and make the necessary changes and improvement to include that piece as well. So thank you for that.
Okay, can I say something again? So I think that's such an important question. And so one thing that we've learned, Amber, is that, you know, Muslims reside in the three metropolitan areas for the most part, but they also do live in other urban centers. So, you know, Montreal, Toronto, the GTA, Vancouver, and then also in Calgary and Edmonton. Winnipeg does have a, you know, Muslim community as well. And then when we look at the Atlantic, there are Muslims, but you know the populations are sparse. And in fact, some of the chapters that we have, you know, they're in communities where there aren't a lot of Muslims. So we're learning from them, you know, when they tell us about the barriers that exist. Just we're not talking about, you know, gender-based violence, but just barriers for Muslims in communities where there are very few Muslims. So that's something we're aware of. And then maybe what we could do is, you know, as Silmi said, we could add a section on underserved and rural communities and you know, what to consider there. But we have, you know, Sabrine can vouch for this. We've had requests from, I guess, was it the Yukon, or, you know, we've had inquiries from someone who women who are in places where there aren't a lot of Muslims, there aren't a lot of services to begin with, including, other service providers for women experiencing violence, let alone Muslim-focused services. And it's not easy. It's really not easy. There is such a lack of resources already in those communities. So it's a challenge, but maybe we should talk about how we address the challenge, Silmi, in the guide. That would be great. Thank you.
Definitely.
Great feedback. And I see that Saleh's comment. Thank you, Saleh, for that comment. You are very right. It is something to definitely focus on. And I am scanning. Amber says, thank you. Thank you, Amber, for both of your questions. Okay, we have a question by the one and only Shaheen Saeed. She has asked, I believe it's a question, giving agency to the clients to decide their path is critical when they're so vulnerable. This can help establish trust in self and the services they're accessing. It builds accountability within service providers, and this will be of immeasurable value to the GBV Mountain. Absolutely in agreement. Thank you, Shaheen. Being client focused is imperative. I also, Carlos asked the first question regarding sectarian and sexual minorities and how CCMW works exactly with minorities. And I don't feel like we touched, I did want to just briefly say that CCMW, when we receive clients, everybody is welcome. And we also try even beyond that to create a very clear space where we welcome individuals in Muslim communities that are both sexually and gender diverse. We include very important discussions within the Muslim Women Scholars Series and so forth. We don't shy away from that at all, and we try to be as inclusive as possible. I just want to add that. Okay, so we have 2 minutes left. If anybody has any last minute questions or feedback, all your feedback is always welcome. So Najis wrote in response to Amber, that's great. So Najis is from Sakina, and they recently opened a shelter in Winnipeg and can help with women in rural areas. So that's great to hear. Thank you. If we have no more questions, we could just go to the next section, which is really just the closing remarks. Are we okay with doing that?
Sure.
Great. So I want to thank each and every one of you for being here. A thank you to the speakers and specifically Silmi for all the great work you've done in the development of the guide. An evaluation link will be emailed to each of you shortly. We ask that you please do complete it. And that if you or someone you know is experiencing any form of gender-based violence within the Muslim community, please contact us. And to get involved, whether you are interested in partnership initiatives or learning more about our GBV program, please email us at gbv@ccmw.com. I'm going to pass it along to Nazha just for the final closing remarks.
Okay, thank you so much. Thank you to Silmi and to our guests, Yasmin and Phoebe, for sharing with us their experience in using the guide. And of course, first and foremost, Silmi, mashallah, has done an amazing job. You know, when I envisioned this guide, it was exactly how Silmi has developed it, and the end product is, speaks for itself. And I kept on saying to everybody, it is really unique. I don't think anyone else has done something like this before. I don't think anyone has, looked at the 4 frameworks, that she's used. Those lenses are so important, so different from other organizations or other guides that I've seen. And because it really does, immerse you into what it's like to be a Muslim person who's seeking services and ask the right questions. Now, of course, it doesn't cover everything. I'm sure there'll be things that we'll think about. Oh, we didn't ask that. That's okay. because I believe in continuous improvement. And one of the reasons why, so a tool like this is really important is to allow you to improve your services and your programs and policies on an ongoing basis. And I was really heartened to hear from each of you to say that we're thinking about a new program or a new service, and we're going to apply, this guide to when we're doing the development. And Maya, you raised some really good points about other service providers like the healthcare sector. Even employers can use this as a tool to determine their employment policies and practices and the barriers that may exist. So it's really a multi-purpose tool, but it is designed, of course, for our sector. But certainly healthcare and other social service organizations, settlement agencies would find it very useful too. And the other thing that we're hoping to do is really, continue to roll out information about the guide and provide workshops to people in using it. So there'll be lots of opportunities for education and sharing information about it. Thank you all for attending this evening. And I really appreciated your attention. I appreciated your enthusiasm about the tool. I know it's kind of a nerdy product, something that people may not think about. Oh my goodness, what's a review guide? But here it is. And you got to see what that guide looks like and how it can be helpful to all of us. So thank you again for being here. And I'm appreciative of our amazing team who's been working behind the scenes. I have to recognize them. So Zainab, take a bow. She's been our communications genius and been working really hard to get everything ready and communicate about this, including creating a page on our website where you can go and download the document. And by the way, if you haven't seen our gender-based violence social media campaign posters that are available in multiple languages, and if you serve many different clients who speak diverse languages, you can download all of that information from our website to educate your clients and also your teams. So Zainab's the mastermind behind that, also supported by Iman, who's actually our digital communications coordinator. So she's here, and Sabrine, of course, who facilitated this discussion. And she's our first line of contact with all those women that contact us looking for coordination of services. And she does a great job. So once again, thank you for your attention. Thank you everyone for contributing to the project. I really appreciate the partners who tested it. And then we're going to move to the next phase, which you'll probably be hearing about over the next little while, where we're going to have more organizations. And if any of your organizations want to volunteer to do a review of your policies, programs, and service practices, please go ahead, identify yourself to Silmi, and she'll work with you to make it happen, because then you can be included in our final report on what the findings were and what were the typical gaps, and also best practices that can be shared in the report that we do based on the reviews that we've already done with you, that you've already done, our 7 partners, and then maybe you would want your agency to do it. So get in touch. Silmi's put her contact information there, or you can just write to gbv@ccmw.com. All right. Thank you and good evening, everyone. Have a good rest of December 6th. I know it was a somber day, but I think this really helped us, center what we should be doing. Thank you.
Thank you, everyone.